Greetings. This is Mr. Farhad Lutfi, a second-year PhD candidate at the University of Belgrade. We are gonna introduce our research article, our scoping review article entitled "Identifying the Application of Process Mining Technique to Visualize and Manage in the Healthcare Systems." And our table of content include abstract, introduction, methods, discussion, and finally the conclusion. This study aims to identify the application of process mining in health centers for the visualization of healthcare activities. As a scoping review, this research was used and divided into 3 phases: literature collection, assessment, and selection. A literature research or search had done on Google Scholar, Web of Science, PubMed, Elsevier, and Procust. Keywords have been addressed as follows: process mining, visualizing, mapping, workflow mining, and so on. The findings showed that process mining can be used to analyze different activities in the field of healthcare, as well as smart healthcare, including workflow in healthcare. And finally, as a significance of this research, it has been argued that the use of process mining in healthcare allows health professionals to understand the actual implementation of process. Process mining technology include discovering the correlation, modeling the healthcare, controlling infection, emergency response, in the smart healthcare, real-time responsiveness is played as the vital role. Process mining technology has been able to improve healthcare and reduce the cost of this system by discovering the correlation in data. As well as process mining has been considered in many organizations, but healthcare systems have more complex processes than other industries. A subsystematic method was used, which was divided into 3 phases: literature collection, assessment, selection. And as I mentioned, our motor engines, including Google Scholar, Web of Science, PubMed, and so on, from 2007 to 2021, along with the impact of inclusion and exclusion criteria. For example, inclusion criteria, our period of time of 14 years from 2007 to 2021, and primary keywords include process mining or workflow mining, with the scope of information technology and healthcare. And inclusion, any study outside this date, any study without this title, abstract keyword, and so on. And second, search terms and strategies. For example, Spider2S, hospital or healthcare center or pre-hospital emergency and process mining was our search term of Spider2S. And our results showed the mortality rate of patients referring to emergency calls at the time of COVID-19, and the amount of the use ambulances with COVID-19 roughly was 10% more than other patients. Also, the acceptance rate for COVID-19 disease in hospital was about 49%, while in another groups, 22%. In addition, the acceptance rate for COVID-19 in ICU was nearly 5% higher than other patients. Our process mining capabilities were put in one diagram process mining capabilities. First of all, specifying the type and place of the required change in process. Second, discovering the actual process and presenting it in the form of a model, extracting process information and calculating KPIs for evaluation by decision makers. And fourth section is named Achieve Complete Transparency and Identifying Possible Subjects Before. And then examples of practical process mining applications in healthcare. For example, we would like to talk about the first one, from tool, country of the Netherlands. And the outcome showed information analysis and production of model can be obtained by tools and techniques of process mining for using less structured, flexible, and multidisciplinary processes, as well as multidisciplinary other knowledge. The result of the application of process mining in health in the Netherlands, as I mentioned, a better understanding of the healthcare system and studying and analyzing process in the emergency department in depth. Using process mining as an appropriate and flexible tool to improving the performance of treatment processes has been chosen. For example, Zhu et al. Argued that discovering the actual process and identifying possible subjects before the occurrence has been introduced as some process mining capabilities, so which in previous studies, in particular, process mining techniques could be used to analyze complex data, manage term, and so on. These techniques can also focus on treatment, on managing the patient's behaviors, analysis of diagnoses to improve the health systems in real-time responsiveness. The goal of this research was to improve healthcare systems by using process mining technique. Actually, some main limitations of process mining are as follows: access to appropriate, correct, and complete process data or data sets as well. In addition, improved usability for non-experts. This study found easy to identify the application of process mining for visualization of healthcare activities. Finally, available research related to the use of process mining in healthcare was investigated. And thank you for your attention. And